I'm Megan.
I'm Jaden.
And we're doing our assessment injury management video and the foot evaluation. So to start off, like with our patients, we would first ask them their signs and symptoms. Basically, like ask them about their injury, like what happened, where does it hurt, what type of pain is it, did you hear any noises, have you hurt this foot or injury, have this occurred before, what type of surface were you on, what shoes did you wear, have you had any previous medical problems, etc., etc. And then we would go through our evaluation, starting with fracture tests and going through the rest of the evaluation. Also, everything that we do on one side, we would do bilaterally because you need something to compare it to. So if your right foot is injured, we would compare it to the left foot. For a base, we would also check for any deformities like in the foot that would predispose you to certain conditions, such as pes cavus foot, which is a high arch foot, pes planus foot, which is a flat foot, Morton's toe, which your first toe is shorter than your second toe. And so these are important in discovering an injury because some conditions predispose you to.
So first I would ask my patient do I have permission to touch your foot?
Yeah.
Okay, so I'm going to be palpating the medial malleolus, which is located right here.
First, I'd ask my patient if I have permission to touch their feet. Jaden, can I touch your foot?
Permission granted.
And this goes for the rest of the exam. Can I touch your foot?
Mm-hmm.
Okay. I'm gonna push down on your foot. Can you push like up towards me?
Mm-hmm.
Okay. I'm palpating the navicular, which is right here.
So now I'll be palpating the first cuneiform, which then I would go right along the first metatarsal bone. And I would go until I feel a groove, and then it would be right behind the groove, which would be located right here.
I'm going to be palpating the third cuneiform. So I'm going to follow the third metatarsal up until I find the groove, and then it's right proximal to that. So right there.
Okay, so now I will be palpating the head of the talus, and I would then ask my patient to evert their foot. And once they evert their foot, I can feel it right in this little space here.
You're doing a great job showing it.
Ooh.
Try again. Just.
I'll be palpating the talus here. I would feel the space here, and I would then ask my patient to evert their foot. Which then will be right here.
I'm going to palpate the metatarsals 1 through 5. One, 2, 3, 4, 5.
So now I'll be palpating the phalanges. We'll start by grabbing the big toe, and here I will grab the proximal phalanx and the distal, and all the rest of them have the proximal, middle, and distal, which proximal is located here, middle is here, and distal is on the far end. I'll do it for the other toe, proximal, middle, distal, proximal, middle, distal, and proximal, middle, and distal.
I'm going to be palpating the DIP joints, so the distal interphalangeal joints. 3, 4, and 5.
So here I will be demonstrating range of motion testing of the big toe. I will be showing flexion, and I would put this here. And I would ask my patient to bring their big toe up to their face, please. Okay, there was about 30 degrees of active range of motion, and then I would tell my patient I'm going to grab their big toe and bring it as far up to their face as I can. Which then I got 20 more degrees there. And then I would have them perform a break test.
Just cut it.
So here I'll be performing the range of motion testing on the ankle. Which then, here I would ask my patient to bring their foot inwards. And I got about 6 degrees of active range of motion And then I would tell my patient I'm going to grab here and I'm going to push it in as far as I can, which that got about 5 more degrees range of motion.
I'm going to be palpating the spring ligament. I'm going to be palpating the tarsal ligaments. You can see. This is
So here I'll be palpating the metatarsal ligaments. I would go in between each metatarsal.
Okay, I'm going to be palpating the extensor hallucis longus. The origin is the middle half of the medial fibula, and the insertion is the dorsal base of the distal phalanx of the great toe. It's innervated by the deep fibular nerve, and its action is extension of the great toe, and it goes all the way out to the big toe.
So here I'll be palpating the Achilles tendon. So I'll be right here. And the origin of this tendon is the gastrocnemius in the soleus complex, and it inserts on the heel bone, and the innervation is the sural nerve. And the action is it lifts the heel off the ground during activity, and it enables posterior leg muscles to plantar flex the foot and stabilize the ankle joint during the GAT cycle.
I'm going to be palpating the extensor digitorum brevis. The origin is the superolateral calcaneus. The insertion is the base of the proximal phalanx of the great toe. And then it's innervated by the deep fibular nerve, and it flexes toes 2 through 5, so it goes out to all the toes.
So here I will be palpating the flexor hallucis longus tendon. And the origin of this is the posterior surface of the fibula, and it's adjacent to the interosseous membrane, and it inserts on the plantar surface of the distal phalanx of the great toe, and it innervates the tibial nerve, and it flexes the great toe.
We're going to ignore Jaden's dirty feet. I'm going to be palpating the flexor digitorum brevis. The origin is the plantar aponeurosis, and then the insertion is the plantar sides of the middle phalanges of the lateral foretoes, so 2 through 5. And then the innervation is the medial plantar nerve, and it flexes toes 2 through 5 at the PIP joint. And so it literally just goes up to all of these. Gosh, your feet are really dirty. Sorry, keep it professional.
So here I'll be palpating the peroneal longus. Start here. And the origin is the head and the upper lateral surface of the fibula. The insertion is the base of the first metatarsal. The innervation is the superficial fibular nerve, and the action is it everts the foot.
Okay, I'm going to be finding the pulse of the dorsal pedal artery. So it's between the extension hallucis tendon and the extension digitorum tendon. So it's like right here. And I can feel it right where Jaden's hair and his feet.
So here I'll be myotomy testing L4 by ankle dorsiflexion. And here I will stabilize the joint. I will ask my patient to pull their foot as hard as they can up to their face. I'll resist for about 10 seconds. Ready, set, go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And I would perform it on the other side too, usually, but for the sake of the video, I will not.
No, we're saying that I'm going to be testing the S1, myotome testing the S1 route with plantar infection and eversion of the foot. So I would tell my patient, I'm going to grab the bottom of their foot, hold at the back. Can you flex your foot up a little? And then I'm going to tell them to like push down like you're pressing on a gas pedal, but I'm going to resist you for 10 seconds. Go ahead. 1, 2.
Wait, no, restart.
I got scared of that. I knew that was gonna happen.
I'm gonna be testing my toe testing the S1 root with plantar flexion and eversion. So I would tell my patient to, you can relax a little. I'm gonna put their foot here and I'm gonna push on the bottom of my patient's foot and tell them to press down like a gas pedal, and I'm gonna resist them for 10 seconds. Go ahead. 2, 3, 4, 5, 6, 7, 8, 9, 10. Nice, Jaden. Okay, I'm gonna be testing the dermatomes of the L4, which deals with the great toe, and it's like posterior rami and sensory. So I'm taking one of these and pulling out the little paintbrush. I'm going to tell my patient to close their eyes and then let me know when you feel me touching you. So Jaden, close your eyes. Let me know when you feel me touching you.
I feel it.
Okay. And if the patient didn't feel that, with the little brush thing, you can take the stabber. And if
I feel it.
Yeah, all right, well, and test their pain.
I'll be reflex testing the Achilles tendon. I will support my patient with dorsiflexion. I'm going to hit the tendon and I'm trying to feel and watch the foot plantar flex. Okay. Might be a little hard to see, but it just did it. Yep. I feel it. All right, now I will be ligaments testing the tarsal ligaments. And here, you're looking to not like go side to side, but to shear them, go pretty much like up and down.
No.
What do you mean no?
Grab and shear. Remember, don't rotate though. Remember, these were kind of hard. Yes, like that.
Okay. So here I will be ligamentous testing the tarsal ligaments. And here I'm looking to get like a shearing action, not like side to side. Keep doing each individual one. And if your patient would have any discomfort with this, then you would know there would be a problem.
Okay, I'm gonna be ligamentous testing the metatarsal ligaments. So it's the same thing basically as the tarsal ligaments. You're gonna do a shearing action, but at the metatarsal ligaments. So I'm gonna grab and just go through toes, sorry. And just up and down, well, like opposites. And you can test each one. And you want to make sure it's like a straight up and down and not rotate or twist.
So now I'm ligamentous testing the spring ligament. And here I'm looking to straighten it out. And if there would be any pain with this, there would then be an issue with the spring ligament. So here we can see it's straightened out and she has no pain.
Okay, I'm gonna be muscle testing the anterior tibialis. So first I'm gonna stabilize above the joint. And then I would first have my patient go into active range of motion. So Jaden, can you pull your toes towards your face? Okay, good. And then I'm gonna apply resistance, so active resistance. I'm gonna first put him into a stretch position, and then you're gonna do that same thing, and I'm just gonna resist you. And go. Yep, keep going. Okay, good. And then I'm gonna perform a break test. I'm gonna put him into a like moderate position, and I'm gonna apply resistance, and don't let me break you. And we're gonna do it for 5 seconds. Ready, set, go. 1, 2, 3, 4, 5. And so he can resist against obviously all my pressure, and he can go through all of the range of motion, so that's a 5. If he could resist against like moderate pressure, that would be a 4. If he could like go through the whole range of motion by himself but without resistance, that would be a 3. And then a 2 would be like he can go through it without gravity. And then a 1, he can't do movement but he can contract. And then a 0 would be no contraction. Okay, next I'm gonna muscle test the extensor digitorum brevis. So I'm gonna stabilize above the joint, and the extensor digitorum brevis is digits 2 through 5, so the big toe doesn't really count. But, so Jaden, pull, like try to flex your toes towards your face. Okay, good. And then I'm gonna resist each toe at a time. So go ahead and pull it towards your face. Yep, Keep going. Okay, good. And then we're gonna perform a break test. So we're gonna hold it here. Don't let me push your toes down. Ready, set, go. 1, 2, 3, 4, 5. And then I would normally do it on all 4 toes, but for the sake of time, we're only doing it on 1.
So here I will be muscle testing the flexor hallucis longus. That'll be done with the big toe by flexing it. So here I will ask my patient, well first I will stabilize below the joint, and I will here ask my patient to flex their toes down towards the ground, your big toe. Okay, good.
I can't do it, it's just
This time here I'll put it in a stretch position, and I'm gonna ask her to do the same thing but with a little bit of resistance. All right, go. Go, go, go. All right, good. And here I will put it in a middle position here, and I'll have her perform a break test. So here I will apply pressure upwards. I want you to just try to leave your toe in the same position. Okay. Ready, go. Good. So here I am muscle testing the flexor digitorum longus. And here I will be stabilizing right above the DIP joint of each toe. It's a little tough to see, but I'm getting it here. And here I will ask her to perform an fuck! So here I'm muscle testing the flexor digitorum longus. And I'll do this by stabilizing above the DIP joint, which is about here, it's hard to see. And I will ask her to flex this toe down towards the ground. Okay, good. And then I'm gonna apply a little bit of resistance. I want you to do the same thing. Go. All right, that's good. And here I'll put it into a little middle position here and have her perform a break test. I want you to keep I'm gonna apply resistance. I want you to keep your toe in the same position. Okay. Ready, go. Good. And then I would do that to each individual toe.
Okay, I'm gonna be
oh my god.
Okay, I'm gonna be muscle testing the lumbricals. So I'm gonna stabilize above the MP joint. And then I'm gonna have my patient flex their toes. So can you pull your toes down? Okay, good. And then I'm gonna perform resistance. So I'm gonna put them in a stretch position, and then can you do that same thing? And I'm gonna resist you. Go ahead. Go, 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 go. Okay, good. And then I'm gonna perform a break test. I'm gonna put you in that position, and then you're gonna hold it for 5 seconds. Don't let me break you. Ready, set, go. 3, 4, 5. Okay, good. And then I would do it on toes, all the toes, but minus the big toe. But for the sake of the video and time, I'm not going to.
So here I will be muscle testing the gastrocnemius. And here I would ask my patient, well I would stabilize right here, and I would ask my patient to flex their foot towards me. Good. This time I'm going to add a little bit of resistance. I want you to do the same movement. All right, go. Okay. This one I will perform a break test. Hold your foot here in this position. I'm going to give you some resistance. Just keep it here. Ready, go. Good. And now to do the soleus complex, we would have our bend our knee up here to eliminate the gastrocnemius. And I would then ask you to flex your foot to the back of your head. Okay, good. Now I would add a little resistance. I want you to do the same thing. Ready, go. Okay. And now perform a break test. Keep your foot in the same position. I'm gonna add a little resistance. Just keep it here. Ready, go. Good.
Okay, so I'm gonna be performing the Morns-Roma special test, and that's typically when like the nerve is irritated in between the 3rd and 4th toe or the 2nd and 3rd toe. So I would take like a pencil or like honestly something that you can just like stick in between the toes, and in between like the metatarsals, if you push and there's pain, then their nerve is irritated. But I'm pushing and Jaden has no pain, so his nerve is fine. You can also test on the bottom side too. No pain.
So here I performing a special test, which is the feast line test. And here I'm making 2 dots, one being at the first MP joint, and the second one being here at the distal end of the medial malleolus. And I'm connecting the line here between the 2 points. And this 3rd dot here is the navicular. and I'm seeing where it falls along the line. If it's below the line, you're more of a pes planus foot, which hers here is if you're more on the line. It's a little below, but it's pretty much on the line. You'd be more in a neutral position. And if it's highly above it, it would be more of a pes cavus foot.
Okay, so I am performing the supple pes planus special test. So basically I would have my patient in non-weight bearing position and like look at their arch. And so Jaden here has like a very normal arch. And then I would have them stand up, and then people with pes planus feet, their arch would basically disappear and their foot would go flat. But Jaden here has a normal arch, so he's a negative test. Fracture test and like testing our bones like for the injury, because you can't really do the other tests without testing to see if you injured a bone first. So we would start with that, and then we would move through the evaluation sheet based on like our patient's signs and symptoms, and like bruising, swelling, anything like that would like dictate which tests we do. And through your findings and our testings, like we'd be able to create a plan of action and course of treatment for